Welcome, I'm Dr. Seth Rosenzweig, board-certified orthopedic surgeon, part of Louisiana Orthopedic Specialist, Acadiana's leader in orthopedics, spine, and sports medicine. We're also proud sponsors and supporters of the Acadiana local high schools and the University of Louisiana. This video will help you learn a little bit more about these orthopedic injuries, the process, some of the ways we treat them, and how you're going to recover. So in this particular patient, it's a young female, and a lot of young females, she has what we call laxity, meaning just very stretchy. Her ligaments have a little extra stretch to them, and that's just the way she's built. Elbow goes hyperextended, thumb I can touch the forearm, and I'm gonna have the camera come over here. And one of the things you can notice is if you look, I'm gonna actually pull her shoulder downwards out of the socket. And you can see this dimple here, right there, when I do it. Now the other thing that happens is when her arm goes back to play or to throw, she goes backwards out of socket. And I don't know if you can appreciate it. And a lot of girls, it doesn't bother them, but in a lot of these athletes, it does. And so her ball slips out the back of the socket. It's causing her a lot of pain. It's banging on the rotator cuff, the back of the capsule. So she's got excellent motion, but unfortunately her rotator cuff does not do a good enough job of controlling her ball. So we're gonna tighten her in a little in the back, possibly a little in the front. And the fact that I can pull her down out of socket, I may even put a stitch in what we call the rotator cuff interval. I'm gonna make her tight, and she's not gonna like me for a couple of months, but once she stretches through the repair a little bit, I think she'll be much happier, less pain, and in her brain, she'll teach that ball how to sit in the middle of the socket. So this is a standard lateral positioning for arthroscopy, very good for instability. And once we've inserted the camera into the shoulder, we're looking from the back to the front, and her ball is on the top of the screen, the socket at the bottom. We're about to see her biceps tendon there to the right. I'll follow it into the front of the shoulder to see the subscapularis tendon, and then I like to come up and look at the rotator cuff, which is actually quite nice in her, which you would expect. And then I'm going to drive into the front of the shoulder because I want to show that I can go all the way down to the bottom of her socket, and that's called a drive-through sign. Most people, you can't do that, but in her, because of her laxity, we can. And so I'm coming to the back of the shoulder. I'm going to look down on the glenoids of the socket. Looks much like a golf tee. And the labrum's that speed bump looking structure around the socket. Now I'm going to put my camera in the front of the shoulder because I want to look to the back, and I'm looking right now at the back of the shoulder where you see that cannula. And I want to show you guys all the space back there that the ball can jump over that labrum and hit the back of the shoulder. Now we're going to look at the front of the shoulder, and you'll notice I'm actually going to put a hole in the bottom of the front of the socket. And the reason I'm doing this is because I want to sew some of her tissue and close down the space. So I'm putting a second hole because I want to do two here. And you see I have a passing device. I'm going to grab some of her ligament at the bottom of the front of the shoulder and some of the speed bump, and together I'm going to sew those into that hole. Now there's a couple different ways you can pass your sutures around, and I'm using what we call a shuttle type system. And I'm actually going to pass the polyethylene type of suture we're going to use. It's a very strong rope-like suture, very strong, non-absorbable. I'm going to tie a knot called a cinch loop, which is a Boy Scout sliding type of knot, which is going to allow me to grab a good piece of this ligament, her labrum, and you're going to see I'm going to place this into an anchor into the hole. We're going to go to the bottom hole initially, and this anchor is going to help me pull that tissue into the hole, and you can see we've already pulled up this large amount of tissue to create not only a speed bump, but we're tensioning the bottom of her shoulder. I want to repeat this one more time. I'm going to pass again. I'm grabbing some ligament, some capsule, and a little bit of labrum, and I'm going to shuttle yet another strong suture, and this one will be a different color. That helps us differentiate when we're potentially putting several anchors, several knots in. And so we're shuttling this particular suture. Again, I'm going to use what we call a cinch knot. And you'll notice this one's blue. And we're going to place it into another anchor. And I've already drilled my hole. I'm pulling down my knot excellent hold. You can see a lot of surface area we're grabbing there. And then these are knotless anchors. Traditionally, we can tie knots, but within the shoulder, I just find the knots can irritate their cartilage, the tissue around. So I like these knotless ones where we can cut the suture right at the level of the socket so that there's nothing remaining. And so we've done this, and now we're going to go to the back of the shoulder. I want to do the same thing in the back. So you see the ball, you see me grabbing some of that thick ligament down below. I'm going to grab some of the labrum, the speed bump, and I'm going to sew this again into a hole that I still need to make in the socket. I'm using this wire just as a shuttle. I'm going to bring it out the front of the shoulder. I'm actually going to load my suture. I'm going to grab the two tails, make that cinch knot we had talked about, and then I still need to drill my hole. So you'll see a drill guide come down, and a very well controlled process. We're pumping water into the joint the whole time so the drill stays cool. I'm going to do 2 more holes. I'm fairly low on her socket. I'm looking from above looking down. So we're looking towards the bottom of the socket, and you're going to see I'm going to place another anchor. I'm pulling all this tissue into the socket, closing down space, inserting the first anchor, and I'm going to do a second. And so you'll see we'll remove this, we'll cut the suture. Here comes my second pass. Again, I want to get low. I want to grab some ligament. I want to grab some capsule. I'm going to grab some labrum. We're passing our shuttle stitch. We're going to bring back another color suture. And once again, final anchor in the back. But one more thing we are going to do. Because I made a hole in the back of the shoulder to put my camera, I want to close this. Every bit of closure we do helps with tightening her, and we're here because we think her tissue is too lax and loose. So I'm closing the hole I made with my camera. So here comes my shuttle again, and I'm coming above it, above the hole, and I'm going to pass another one of those strong sutures. See me shuttling, and boom, there goes the hole, nice and closed. You'll see the suture just got passed. I'm tying a knot on the back side of it. And once we're done, look how nicely we've closed the back of the shoulder, the ball centered, and we've accomplished everything that we wanted to in the case, tightening her from the front and the back. Thank you for watching. Please subscribe to this channel to watch more of my videos. If you have joint pain or a sports-related injury, I'm here to help. I want to help you live your life to its fullest.